what I was getting to is that in Asian Americans, it's much less likely to happen. The risk is 1 in 100,000. But in men, CF often causes infertility, which is I guess good from a genetic standpoint, but it's a very difficult symptom for many who want to have children. Um, because it's a genetic disease, it's not contagious. Infections from B. senescapacea, however, are contagious. It spreads similar to the cold, where it spreads like human contact, namely droplets from other humans. It can also transmit between indirect human contact, and there's evidence that it can be transmitted through the environment. Um, this can be prevented obviously by wearing masks, but if we weren't in a pandemic, no one would really be doing that on a normal basis to stop themselves from getting this. And it that avoids catching droplets from other people, and you can also just avoid excessive human contact. Like I said earlier, there is no cure for CF, but there's extensive research that continues to be done to reach a wider array of people. If you remember earlier, I said there were over 2,000 mutations to the CFTR gene that governs mucus production, among other things. So they're slowly finding ways to fix more and more of those mutations, but there's still so many mutations that we aren't able to fix. So there's no cure for that reason. However, CF patients have been seeing their life expectancy rise among other benefits. Um, there are many treatments options available to try to alleviate the symptoms of CF, including airway clearance such as inhaled medicines such as albuterol, which is what people like me with asthma use when they're inhalers, or antibiotics to combat infections. Pancreatic enzymes also improve nutrient absorption, which can be a problem for CF patients, and fitness plans and trainers to help improve the quality of life. There is a treatment to attack the mutation of the CFTR gene using gene therapy, but like I said, they're only effective in certain cases because they've only been developed for a few of the many mutations thus far. There is still an extensive research being done to better some of the gene mutations for CFTR. There is an extensive variety of mutations. Like I said, over 2,000. There's a myriad of mutations that cause CF. So a wide variety of medications would be necessary to attack each mutation effectively enough to completely eliminate CF. So we're still very, very far away from that. We may never quite reach it. According to the Cystic Fibrosis Foundation, about a dozen new treatments have been recently FDA approved, which is a testament to the dedication of the researchers working on the debilitating disease, because that's a lot of things to get FDA approved. And finally, detection. In the United States, all newborns are screened for cystic fibrosis now. Doctors may use a sweat test. If you have a salty sweat, it's a sign of CF because it's something with the CFTR gene. Mothers often notice that when they kiss their babies for the first time, they'll think it tastes weird. To determine if there's signs of CF, but if the results are negative, it's not necessarily an indication of your child not having cystic fibrosis. Again, similar to the sweat test, a blood test can determine if there are high levels of a molecule called immunoreactive trypsinogen, or IRT, which is a chemical secreted by the pancreas. But like the sweat test, more tests would be needed to determine if the child actually has CF. For teens and adults, it may be suggested that genetic tests, blood work, or sweat tests be done if they exhibit symptoms such as chronic infections or severe congestion, like that common in CF patients. Tests can determine if one is a carrier of the CFTR gene, and a lot of people don't get these tests done, but they may want to find out if they're carriers or if them and their partner are carriers in case they plan on having children, and if they are both carriers about it, there's a 1 in 4 chance that the child would have it. It's actually kind of interesting. So the family I know, they have one kid that has CF, and they have 3 kids that don't have CF. So when you look at that from a mathematical standpoint, That's exactly the probability that you would expect if both of the parents are carriers, because 1 of 4 had it and 3 of 4 didn't. So it's like a Punnett squared. Tests can determine if one is a carrier of the CFTR gene, like I said, which would indicate that they're a carrier for the CR mutation. I think that was supposed to say CF mutation, but CF can be detected during pregnancy using chronic chorionic villus sampling, or CVS, or amniocentesis, which is normally done between 15 to 20 weeks of pregnancy. Alright, well that is the end of my presentation. I hope you enjoyed learning about CF.